Good morning. I am Dr. Manik Mathur, consultant neurologist at GNRC Dispur. We are here today to discuss on this auspicious day of stroke, World Stroke Day, which is on 29th of October. We are here to discuss about various forms of stroke for local public to know in a layman's language. So to start with, I would tell people that how stroke happens. Stroke can be a blockage into your vessels in the brain, or it can be a bleed. There can be a bursting of your vessels. So these are the two simple criteria for stroke. Now, to take on to the first one, which is block in the vessel in your brain, usually occurs due to a cardiac cause, where cardiology can be the mainstay of the problem, where an ambulance travels from the heart to the brain and gets itself stuck, because we should understand that brain vessels are much thinner in diameter as compared to heart or any other organs of the body. So hence this thrombus goes and stucks there and causes a loss of blood, which again in turn causes your different neurological symptoms. And the brain cells start dying, the neuron starts dying. So they have different features we get. Second one comes up where there's a high blood pressure. For example, any renal causes, any essential hypertension, any other causes. There are millions of causes to be discussed, which leads to bursting of the vessel. And once the vessel is burst, the blood accumulates on the brain. Now, whether it's inside or the surface of the brain, both are termed as cerebral hematomas or cerebral hemorrhage. Now, both conditions are very critical because in the cerebral hematoma, we tend to get very serious patients who tend to be unconscious, who go into coma, all those things, unless the blood has been sucked out. Now, there can be two ways, the medical ways and the neurosurgery. Every time neurosurgery cannot play a role in it because it depends where the bleeding is. So neurosurgeons decide on that basis and how much risk to benefit we are taking there. So this is one. Secondly, what we need to tell to the public is that to the normal people, less stressful life, regular checkup, checking of your comorbidities such as diabetes, for example, any heart problems, heart histories in the family, that all counts in this. Very important. So on this day, to make the awareness in the public, it is very important from our GNRC side that we are here for stroke saving people, and we are trying our best to save people by God's grace and the brilliant management team that we have in GNRC, the best doctors, best nurses, and the best equipments for an instant survival rate. So best of the equipments, best of the investigations. We have a whole team which works from when the patient enters the hospital and leaves. So at this day again, I would like to say everyone, take care, be aware and stay safe. Thank you so much. Thank you.